sealed envelope. Okay, so today I'm going to be performing the lumbar active range of motion flexion with a tape measure, a hip external rotation CUT, mobility testing of the lumbar central PA assessment L1 through L5, joint mobilization of the inferior glide of the hip, grades 1 through 4, and a fair test. So I'm going to start with lumbar active range of motion flexion with a tape measure. So David, go ahead and take your shirt off for me. For clarity, I'm going to be using inches to do my measurement today. So David, go ahead and stand in front of me like that. I'm going to be placing my 0 at the TL junction, or as close to L1 as I can. And I'm going to be putting my tape measure down to about in between the PSIS or at S2. Okay. So right now my measurement reads at 4.5 inches. David, I want you to go ahead and bend down like you're going to be touching your toes. Okay. My measurement here is 8 inches. Go ahead and stand back up for me. So the difference between 8 minus 4.5 inches would be 3.5 inches of lumbar flexion actively. Okay, so now we're going to be doing a hip external rotation CUT. This is going to be looking at the contractile structures that do external rotation of the hip. So I want you to go ahead and sit down for me, facing that way. I'm going to lower this one down so that your feet are almost touching the ground. You can stabilize the ground with one foot. Okay. So David, I'm going to be trying to press your leg out or in like this. I want you to meet my resistance, but don't overpower me, trying to keep your foot in the same position. Okay? Ready? 1, 2, 3. Hold, hold, hold. Relax, relax, relax. Good. And did you have any pain with that?
No.
Okay. All right. So now I'm going to be doing mobility testing, looking at the lumbar segments, doing a posterior to anterior assessment of L1 through L5. So David, I want you to lay on your stomach for me, please. Okay. I'm going to be starting at L5. I'm going to be slowly pressing down, looking for how much movement anteriorly the segment has. From here, I can do different grades. Grade 1 would be 0 to 25% of the range. Grade 2 would be 0 to 50% of the range. Grade 3 would be 50 to 100% of the range. And grade 4 would be 75 to 100% of the range. I'm going to move up segment to L4. L3. L2. And L1. Okay. Different grades are indicated for your goal, whether that be pain reduction or to increase mobility at that segment. All right, so go ahead and sit up for me. Now we're going to be doing a joint mobilization of your inferior glide of your hip, and we're also going to be doing those grades 1 through 4. So I want you to go ahead and lay on your back for me. I'm going to be performing this on both hips today. So I'm going to be putting my hands as close to the joint line as possible, up where the ball is meeting the socket. If you need to make a barrier, okay? I'm going to take up the soft tissue first. And then I'm slowly going to scoop your hip downward. Okay, good. So I'm going to do this for about 5 repetitions to get a feel. You can also turn this into treatment by doing multiple repetitions. Again, using the same grading principle. Grade 1 is going to be 0 to 25% of the range. Grade 2 is going to be 0 to 50% of the range. Grade 3 is going to be 50 to 100% of the range. And grade 4 is going to be 75 to 100% of the range. So I'm going to do that same thing on this leg. Taking up the soft tissue first. And then slowly scooping you downward. All right. How'd that feel? Good. Okay. Last but not least, I'm going to be performing a FAIR test. So David, what the FAIR test tests for is piriformis syndrome, or symptoms of sciatica. So I'm going to have you lay on your side facing that way for me. I'm going to lower this down a little bit. Okay. So why don't you come and scoot towards me a little bit. I'm going to bend this leg like that. And stabilize at the pelvis, letting your knee fall down. Do you have any pain with that or any symptom reproduction? No? And I'm slowly going to give some overpressure. Any pain with that or symptom reproduction? Okay? So now we're going to do the same thing on that side, on the other side. So go ahead and face that way for me. Good. I want you to straighten out this bottom leg. And then I'm going to bend this top leg. Again, letting the knee drop out and stabilizing at the pelvis. And slowly giving some overpressure. Any pain with that or symptom reproduction. All right. And you're all done.